natural.
That's what's on there.
I feel like I could turn it up higher.
Typically, I always recommend that if you're going to make an adjustment, go about 0.5, which is half a millimeter. So if you're at 1, just like she did, it's not really seeing much, crank it up, 0.5. On the inverse of that, if he's bleeding like a stuck pig at 1, go down to 0.5.
Now the forehead area is going to be much more tender, so we usually start at 0.5 around that area because of the cranial bones. There's just not as much skin there.
And what I'll do is I'll give you guys some kind of suggested depths using our patient chart. And again, don't take these as gospel, but I'm going to kind of give you a range of, like, on the cheeks, 1 to 2. Forehead, start at 0.5. Around the eyes, we'll do 0.25 to 0.75. And we'll talk about these as we go, and I'll also write these down for y'all so that you can kind of copy it or put that in your notes.
So you have to go up and down and then across.
Circles. Yeah, so you're gonna do 3 passes, and that's our baseline. So we're gonna do a horizontal, a vertical, so cross hatching, and then we're gonna do little circles to kind of fill in. What it does is
Or makes it more flush, like more.
it'll flatten it out.
Yeah.
And what we're doing is basically bundles that didn't come back together correctly. So you have these bundles of collagen that'll cause, sometimes it's a depressed scar, sometimes it's a raised scar. You know. With the raised scars, what you'll see is you can kind of flatten it out. It'll become flush with the tissue around it. And then the color will start to improve those